This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Hey EMM, we are excited to announce that we are now accepting applications for our second annual Diversity and Inclusion Award. The award is eligible to fourth-year med students identifying as underrepresented in medicine and are applying to EM residencies. We are extending 3 $200 awards to selected individuals following a blinded review of all applications. Applications will be accepted through the end of November, with winners being announced mid-December. Check out our website at www.emergencymedicalminute.org/EDI-award for all the details and to access the free application, or you can click on the link in our show notes. Thank you.
So the medical minute I wanted to talk about today is about catheter-related bloodstream infections. So we commonly, try to do these procedures super sterilely. Whenever a patient gets a central line, we do it all under, gowns and drapes and chloroprep and the whole thing, put a biopatch down. And that's all under the kind of theory that the risk of a catheter-related bloodstream infection comes from the skin around it being dirty and then skin flora seeding onto the catheter and leading to an infection. And what we're finding more and more is that that's actually not what happens. And we know that for actually a couple reasons. Most of the bacteria that grow on the tip of these catheters, they don't match the bacteria that are cultured around the site of the catheter. We find that Staph epidermidis, which is commonly ruled as a contaminant, is actually found in the gut of about 50% of patients who are in the ICU. And we found that the things that actually decrease the rate of these infections is actually oral decontamination and early feeding. And so the theory is actually really that most of these infections are happening from gut translocation. So really, we're probably spending all this time decontaminating the wrong surface. So we should, still do things sterilely and cleanly. And, I think it's kind of, the way to think about it is that sterility is more of like kind of a mindset, but it's just food for thought, and really is just more to kind of, give some credence to the notion that really gut flora is critical in patients' health and in their illness. So just thought it's kind of interesting. And does anyone have any questions about any of that? Or okay, great. Well, let's have a good shift today, guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.